Okay, so this morning what I'd like to do is demonstrate how you can actually measure nasal high flow pressures with the LP15 monitor. And what we've done, we've hooked up two different monitors. One is hooked up to the baby's nasopharyngeal cavity, and the other one is hooked up to the Fisher and Paykel nasal high flow cannula through their adapter here. So what we're simply going to do is turn both units on. Let them zero out. Now we're ready to turn on the liter flow, and it's off screen, so you're going to have to trust me on this one. It's going to be turned up to 4 liters, and you can see that we've generated a pressure here on the one monitor. And again, everyone should know by now that the reason for that is when you turn flow through the nasal high flow system, you're going to generate a back pressure. And also everyone should know by now the way you eliminate that is by zeroing the monitor by pressing the 0 cal button, holding for a second. It flashes and it'll take a couple seconds to zero out. And that's an important fact that you need to pass on to your clinical folks that you're working with. Okay, so now we know that they're both zeroed out. We're going to hook it up to the baby, if I can do that. Okay. So you see that the monitors are registering fairly closely. Anything with even a half of a centimeter is more than fine. Again, these happen to be running at exactly the same pressures, which is unique, but it just demonstrates that the nasal cavity pressure and the pressure we're measuring at the nares is very similar. So what we're going to do now quickly is now that we feel comfortable that the pressure is fairly low on this baby at 4 liters, then this is what we have to relay to the clinical folks, that it's okay to go up higher on your liter flow. But when we do that, we're going to go up to 6 liters. You're going to see that the pressure here, when it's off the baby, is high. There's generating a pressure, and that is also because we've increased the resistance through the nasal high flow system. So every time you change the liter flow, you have to re-zero the unit. So that's what we're going to do right here. We're re-zeroing the unit, and we're going to place it back on the baby at 6 liters. And you can see that the monitors are measuring fairly closely the same pressures. So if I'm the clinical folk and I see, okay, at 6 liters, I'm only getting 1 centimeter of water pressure, I can go up even higher if I like. Again, we've done a good job here with measuring the prong size to the nares size, so we probably only have maybe a 50% occlusion, and that is key with measuring the proper prong size. Because if I were to put these in too far, you can see the pressure goes up, or if I were to kink them, the pressure goes way high. So we don't want that to happen, and you get the alarm appropriately. But this is just a quick demonstration to show that you can actually measure pressures very accurately with the monitor using nasal high flow.